Welcome to Strength and Balance Training. My name is Charlotte Kellehar and I'm a physiotherapist for Pilgrims Hospices. Today we're going to talk about why strength and balance is important, the relationship between bone health and falls risk factors related to the person, falls risk factors related to the environment, and what to do if you fall. So why is strength and balance important? Well, it can help reduce the risk of falls and injuries. When we lose our balance, we tend to reach out to save ourselves. This can result in a broken wrist, which may or may not need an operation. But either way, 6 weeks in a cast can make everyday function difficult. If we lose the ability to save ourselves, then the next most common place to take the impact is the hip. A hip fracture requires an operation to be fixed and has a long recovery period, with roughly a third of people not returning to pre-fracture function. You could have a head injury, which can result in a hospital stay. It can result in fear of falling and loss of independence. Strength and balance is important to help you maintain independence for as long as possible. It's important for dignity, living well for longer, not requiring increased levels of care. Example, if you need to use your arms to get out of a chair, why do you think this is? It's usually because your legs are getting weaker and they're unable to lift you out of the chair. In essence, if you don't use it, you lose it. Bone health is important because if your bones aren't strong, they are more likely to break if you fall. Certain medications can increase the risk of having weaker bones. These include steroids, drugs used for treating breast and prostate cancer, anti-seizure and mood-altering drugs, and some diuretics. Steroids increase the activity of the cells that break down bone. Aromatase inhibitors and androgen inhibitors are associated with weaker bones due to the effect it has on the hormones. Anti-seizure and mood-altering medications can cause a drop in vitamin D and reduced gut absorption of calcium and vitamin D. And diuretics can promote the excretion of calcium. The body needs calcium and vitamin D to keep the bones strong. Calcium can be sourced from food intake, dairy or leafy green vegetables, and the best way to get vitamin D is from exposure to the sun. The sun is only strong enough between May and September, and you need to expose your face and forearms for 30 minutes at least 3 times a week. Some cancer medications mean you cannot expose your skin to daylight, in which case you're at risk of low vitamin D. Your doctor can prescribe supplements or other drugs if they think you require more calcium and vitamin D. Weight-bearing exercise, targeted and resistance exercise help to improve your bone density, as any time muscle pulls on bone, it stimulates the bone to regenerate. Have a look at this picture. What things do you think could have caused this lady to fall? There are environmental hazards, like the loose rug, the stool that's in the way. The floor could be slippy, as it's a bathroom. Look at the lady's footwear. High heels can change your posture and your balance. The shoes don't appear to have any grip on them. The lady may have weak legs and the stool was too low for her to stand up from. It's a possibility she could have poor vision and might have banged into objects as she was negotiating the space. The lady could have poor balance and could have forgotten to bring her walking aid with her. She may have perceptual difficulties. She could have had low blood pressure and felt dizzy when she got up. There are many things that can cause you to be at risk of falling. Now we're going to discuss falls risks related to the person. Dizziness. This can be related to postural hypotension when the blood pressure drops with gravity. Ensure good hydration as this can affect your blood pressure. The recommended fluid intake is 6 to 8 glasses of water per day. You can also do ankle movements before you get up to get your circulation going. And then, once you are standing, ensure any dizzy feelings have passed before trying to move off. Eyes. These are one of the main senses that we use for balance. Ensure you're wearing your glasses if you need them and check the glasses are clean. Have regular eye checks. The recommendation is every 6 months. Medications. Anyone taking more than 4 medications is at increased risk of falling. This is due to the interactions that can happen between your medications. High-risk medications are anything to do with the circulatory system, like blood pressure or cardiac medication, or those with a sedative effect. Try to have regular medication reviews with your doctor to minimise any interactions that may cause risk of falls. Medical conditions. Diabetes puts you at higher risk of falling due to fluctuations that can happen with your blood sugar. Parkinson's can affect gait and mobility. Arthritis can affect the way you walk due to pain and restrictive movement. In addition, any acute infection can put you at higher risk of falls. For example, urine or chest infection. Continence. People sometimes restrict their fluid intake because they're worried about incontinence, and this can lead to low blood pressure and dizziness. Also, rushing to the toilet puts you at risk of losing your balance and falling. Sometimes people also restrict their outdoor activity due to fear of not finding a toilet, which can again lead to reduced activity and reduced strength and balance. You can see your GP to arrange for a continence assessment and advice on managing continence. Strength and balance. In order to balance, we need to keep our centre of gravity inside our base of support, which is our feet. We need our saving reactions, which are putting your hands out when you're knocked off balance or stepping out to the side to save your balance. Your muscles need to be strong enough to move in time, and if they aren't, it can increase the risk of falling. Increasing your base of support can help. This might mean using a walking aid such as a stick or Zimmer frame. And exercise helps to keep muscles strong and improve balance. Feet and footwear. If you have pain in your feet from corns, overgrown toenails or bony abnormalities, it can affect the way you walk and increase your risk of falling. See your GP to ask for a referral to a podiatrist, and they can assist with foot care and make referrals if you need inner soles or adaptive footwear. A good shoe comes up high on the bridge of the foot and has a back, can be secured onto the foot with straps or laces and has good grip, flexible sole and no more than a small heel. The same goes for your slippers. If there is no back on your slipper, the feet have to work harder to keep the slippers on, and this can affect your balance and increase your risk of falls. They're especially dangerous on stairs. Pain. If you have pain, you may alter the way that you move to help minimise the pain. However, this can increase your risk of falling. See your doctor to get pain management better controlled. Think about pacing your activity so you don't overdo things and cause you to end up with lots of pain later on. Fatigue is common in palliative care patients and can affect the ability to mobilise and increase your risk of falling. As you become more fatigued, your feet may catch on the ground. You may find that you start shuffling, your walking speed is decreased. Try to manage your fatigue by using pacing strategies. Consider equipment that can help save you energy and accept help if offered. Ears. We use our inner ears to help us balance, and hearing loss is related to increased risk of falls. If you do notice a change in your hearing, see your practice nurse who can check for wax and refer on to audiology if your ears are clear. Sometimes dizziness can be related to your inner ear, and a GP can refer you to an audiovestibular consultant. Changes to mental ability. If your perception changes, it can be harder to accurately judge your surroundings and make safe decisions about movement. If you feel like you are more confused than normal, please see your doctor for assessment. Risks related to the environment. A cluttered environment can cause slip and trip hazards. Reduce the clutter if you can, get organised, try to keep walkways clear, and get help to do so if required. Good lighting is very important, especially if carpet is all one colour on stairs. It helps to see the edges of the steps and feel less disorientated. Keep a lamp by your bedside so you can turn it on in the night before getting up. If you have loose rugs and carpets, replace them, remove them, or use double-sided tape to tape the edges down. Outdoors, there may be uneven paving, tree roots, wet leaves. Consider using a walking aid outdoors, even if you don't need one indoors, and report hazards in the environment outdoors to the council. Pets. People can fall bending down to feed them or trip over them or their toys. Bright coloured collars can help you to see pets, especially if they blend into the environment. In the bathroom, clean up any spills, use non-slip bath mats, consider grab rails and aids to increase your safety when using the toilet and shower. How to get up from the floor. This is taken from Get Up and Go, a booklet produced by the Chartered Society of Physiotherapy, Public Health England and Saga. If you have fallen and are uninjured and you feel like you are able to, roll onto your side and then push up onto your elbows. Use your arms to push yourself onto your hands and knees. Crawl to a very stable piece of furniture, sturdy bed or chair, or some people find that they can pull up on the stairs. Slide or raise the foot of your strongest leg forwards so it's flat on the floor and you're in a half kneeling position. Lean forwards and push up using your arms and front leg. Slowly rise to a standing position, turn around and sit down for a minute or two to rest. But what if you're unable to get up when you fall? There are several things you can do to put a plan in place so that you could call help should you need it. Can you attract attention? Shout, bang on the walls or the floor? Can you keep a mobile phone in your pocket? Pre-program it with numbers? You could think about having a pendant alarm. Or you can keep your landlines on a low table so that you can reach them from the floor. While you're waiting for help, get comfortable. You may have to wait a little while. Pull pillows off the sofa or use a coat to make yourself as comfortable as you can. Keep warm. Use whatever you can reach to keep you warm. even if it means rolling the rug over you. If your bladder opens whilst you're on the floor, try to roll away from the wet patch. Keep moving. Pump your ankles up and down, squeeze your glutes, roll from side to side. Any movement will aid circulation, reduce the risk of pressure sores, and will help to keep you warm while you're waiting for help to arrive. Thank you for listening. We hope this information has been useful for you.